Hi, this is Julia Walker with Grey Duck Forge, and today we're going to be continuing our Hoof Structures series and talking about the bones of the hoof. We'll add in a couple other topics that are all related, like bone anatomy and some other similar types of bones, like stuff like that, to kind of expand a little bit to make everything a little more memorable, hopefully. But we're going to kind of also try and stick to the basics for the most part. So that being said, let's dig into this. First off the bat, the basics. The hoof being, of course, obviously like the part of the foot that we can see here. The bones in the hoof are bones that are either totally in the hoof or partially submerged in that hoof capsule. So the kind of going from the bottom, we'll have your coffin bone. And I'm going to write P3 here in parentheses because it's that third phalanx bone. Phalanx bones being the phalanges or fingers, or like finger bones. So it's that third finger bone. Back here, this little guy in the back is your navicular bone, which is also called the distal sesamoid bone. And it's a sesamoid bone, which we'll talk more about later. And then moving our way up, you've got your short pastern bone, aka P2, or the second phalanx, middle phalanx bone. And then up top, you've got your long pastern bone, or P1. And there's plenty of bones above that, but since the reason that I include that long pastern bone is just because it's, for me, especially when I was learning it, it was helpful to just go 1, 2, 3 and not worry too much about which one's which, but just like make sure, like drill it in. Here's the first one, here's the second, here's the third, and not get too confused along the way. So in terms of the bones in the hoof, that's going to be your short pastern bone, your coffin bone, and your navicular bone. The long pastern obviously isn't in the hoof, but I'm just including it to keep everything straight, and that's just for reference. So, comparative anatomy, it's on certification stuff too a little bit, but starting off, knee and wrist, same structure, same types of bones, functionally same thing, horse to human. And the horse's hock is kind of similar to like our ankle heel area. So the wrist is different from the ankle/heel, and on horses, the knee is different from the hock, and that's going to be really important when you're learning about bones and even some tendon and ligament stuff. But just keeping in mind that front end is different from the back end, very important. Horses stand on their middle finger, which is interesting and also kind of important to know that it's specifically the middle finger because sort of this is the region that we're dealing with here on a horse. And their, metacarpals, which we didn't talk about, but their cannon bone here is similar to the bones that we see when we wiggle our fingers. And, your knuckles here are the same as like a horse's fetlock, right? So that's kind of fun. But the metacarpals, why we're talking about this middle finger specifically, is that the horse's cannon bone is considered their third metacarpal, sometimes written as M3. And then they have splint bones on the backside of their cannon bone, which I'll kind of hint at there with those squiggles. And the splint bones, if this is like the inside and that's the outside, this one here is M2, the second metacarpal, and this one's M4, left over from evolutionary days way back when and ages long gone when horses had more than one toe. So those old cannon bones shriveled up and turned into the splint bones, and have a little ligament in between the cannon bone and the splint bone called that interosseous ligament, which is just a fun thing to know and good to know if you're doing certification things. But they're the second and fourth metacarpals, so they used to have 3 toes, and their old cannon bones still exist. But horses stand on their middle finger, which 1, 2, 3 is that third metacarpal. And then moving on down, long pastern is sort of that first knuckle bone, short pastern, first finger bone is the long pastern, second finger bone is the short pastern, and then that fingertip bone is their coffin bone. So there you go. Other thing to note about basic bone anatomy, we're not going to go over all of this, I promise. That'll be a future video. But the main thing to note is that bones and cartilage kind of go hand in hand, right? So, cartilage isn't a bone, but it sometimes sure loves to turn into bone. And bones have cartilage on them, and that is why, like, when you bone cartilage, just keep in mind that sometimes they like to be involved with each other. It's a toxic relationship in a lot of ways, but they do like to be involved. When you see an x-ray of a long bone, like horse's cannon bone or pastern bones, you'll notice that there's a gap in them when they're young, and that gap is what we refer to as the growth plate, right? But it's not actually a gap. Like if the horse was dead and you took everything off of the leg and you looked at the bone, there wouldn't be like a giant slice missing in the bone. That would be crazy. It's cartilage. So growth plates are made out of cartilage. Bones also, interestingly enough, have cartilage on the ends of them, and it's called articular cartilage because it's cartilage that covers the articulating surface of the bone, meaning where that joint articulates, the surface where all multiple bones meet need to be cushioned by something, and cartilage is a great cushion. So there's cartilage on the ends of bones where bones touch each other, and that cartilage is called articular cartilage, and it can get damaged, and it can turn into bone, and that's arthritis. A, right? Articular cartilage, arthritis. So, and not all arthritis is in that area. Sometimes it can happen to the bone skin, called that periosteum, but generally, we're looking at damage to the articular cartilage on a bone being arthritis. So cartilage turning to bone. In the case of growth plate, normal, expected, wanted even. In terms of the articular cartilage, not normal, not expected, not wanted. So cartilage, bones, just a good thing to know. So the coffin bone has a lot of names. I've written them all down here. We're gonna bushwhack through these. P3 is one that I call it a lot because it's really short, especially when you're taking notes. Writing P3 is so much faster than writing coffin bone or distal phalanx. But here we have this is phalanx, that spelling of that word. And you see that it's got that PH, and that's finger, same sound, PH, F, phalanx, finger. You got this. And then distal, think like the word distant, meaning like far away from specifically the heart. So distal, phalanx, distant, finger bone. Fantastic. Farthest away from the heart. P3 is 3 coming from that third phalanx because there's 1, 2, 3 phalanx bones, long, short, and coffin bone. So this one being the third from the heart. So this one's the second and first. Fantastic. So 3, third phalanx, P, phalanx. Pedal bone, I don't know why it's called that. I think that's more of a European thing, but I could be wrong. And coffin bone, the lore on that is because the coffin bone is totally encased in the hoof capsule, much in the way that a dead body is encased in a coffin. It's a little dark, but I love it, so it's a great word, and it's memorable, so, coffin bone. The main reason that we go through all these is because it's important to be able to know all of the words for something so that if somebody is stuck using, referring to the distal phalanx and they won't call the coffin bone anything else, at least you know which bone they're talking about. Things to know about the coffin bone: highly vascular, gets insane amount of blood supply. It's a huge part of the horse's circulatory system. Like, their legs are pneumatic. Like, there's fluid coming in and out because they land on the ground and then come off, compress and decompress, and that pumping of blood is a huge part of how the horse's circulatory system works. So, because of that, it's got room for all sorts of blood vessels, big and small, right? These little guys here are all for blood. So, pretty incredible that way. It undergoes incredibly high forces when the horses are in work. The blood helps cushion that. So it's giving up some of that like hard physical strength of cortical bone and replacing it with cushioning strength of liquid blood. But because there are a lot of holes in it, it also makes it a little more brittle, a little more prone to fracture. Fractures to P3 can be manageable depending on how bad it is. But when it happens, if it is something the vet thinks that can be managed, usually it's something like a shoe with 3 clips, like one at the toe, one at either side, just to help like lock that foot together, like you're putting on a cast, but on that far edge of the foot, so that it's just holding everything together, clamping things down, saying do not move for the love of God. And that is how you're going to end up treating a coffin bone fracture. Toe caps are like a clip that go all the way around the foot. And those are sort of the 2 main ones. You know, I'm sure people have played around with like casting the foot, which is not going to be as strong as obviously steel. You know, fiberglass isn't steel. And then, you know, like maybe gluing on braces or something is probably something people have tried. But 3 clips, that's something a normal person can do. Toe caps, that's something a really fancy, really skilled person can do. And clip fit's going to be important for that too. But that's what you got to know about that for the most part. There's more to say about coffin bone fractures, but that's where we're going to go certification-wise today. And the coffin bone is attached to the hoof wall via the lamina. Very important structure of the hoof. There'll be a whole separate video about the lamina. But problems with the laminar attachment can be catastrophic, like laminitis. That's where we're talking inflammation of the lamina, coffin bone either rotating or sinking into the hoof capsule. So there's a lot to be said about the coffin bone. The navicular bone is kind of right in that area, but it's more the foot for the back part of the bone. If the coffin bone is the navicular bone is a bone for the back part of the foot, whereas the coffin bone is more of a bone for the front part of the foot. It's also called that distal sesamoid bone. It works hard for its keep, high force area, right? That coffin joint undergoes a lot of forces. If you think of all the different structures going on in there, that deep digital flexor tendon is running right over the navicular bone, and it's navicular bursa, which is another fluid-filled sac to help cushion things. So fluid cushioning things, very important theme that we'll notice with this anatomy stuff. And the navicular bone acts kind of like a pulley that doesn't rotate. It adds surface area to the joint. And when you're thinking of pressure, like pressure in that coffin joint area, pressure is force per unit area. So the more you can increase the surface area of something, the lower the pressure will be. And that's sort of the principle that is guiding this existence of the navicular bone. And it gives the tendon something smooth and easy to glide over. Problems with the region are called, kind of looped into that general term, navicular syndrome. Caudal heel pain gets thrown around. I think that's a little bit of a redundant term because obviously the heels are caudal. That's the point of a heel. Caudal meaning like on the back part or towards the tail direction of the critter. And yeah, obviously heels are in that direction. So, but problems that are involved in navicular syndrome could be with that navicular bone. That's sort of the main one, but it could also be with the bursa. It could be tendinous involving that deep digital flexor tendon. And there's a lot of other structures in that area. There's ligaments. Even the backside of the coffin bone and that impar ligament in there. There's a lot of stuff involved. So, it's navicular syndrome indicates a problem with that region, not always the bone, but frequently the bone itself. Short pastern bone, also called P2, or the second phalanx, and I wrote incorrectly. Or the middle phalanx bone. So it's the middle phalanx. It's in the pastern, and it's the short one in the pastern. So I'm usually going to refer to it as P2, but short pastern bone is also kind of the frequent colloquial term that we use. And in combination with P1 and P3, you can use it to evaluate bony alignment or that hoof pastern axis being accurate or in alignment with x-rays. Irritations to the cartilage on either end of that short pastern bone are going to be causing an issue called ring bone. And low ring bone is if you've got your short pastern bone here and your long pastern and your coffin bone, low ring bone is going to be on the low side of that short pastern bone involving that coffin joint, and high ring bone is going to be on the high side of that short pastern bone. So short pastern bone, you can have ring bone on either side. Low is on the bottom of the short pastern, high, top of the short pastern. Just when you think ring bone, think that short pastern bone. Cool. So there you are. Those are the bones that are at least up to there in the hoof. And types of bones is just another thing that I feel like is worthy of discussing at this point. There are 5 generally when you Google around even, you'll find that there are generally 5 types of bones. Long bones being like your pastern bones, your cannon bone. They're bones that are used as levers in the skeleton. And those are going to be ones that grow on either side of a growth plate, kind of. So expanding kind of in that one direction, that one axis. Short bones, though, are that's when we're talking about like things like the bones in a horse's knee or in their hock. Those little cube-shaped bones that are really small, really dense, they are used to bear lots of weight. So imagine if the knee was just one piece of bone. If, it had a lot of weight on the outside of it or the inside of it, like it maybe would break a little bit easier if it was all one solid piece, but if it's pre-broken up into cubes, it's harder to break. Like, how do you shatter a dish full of, or not a dish, but how do you shatter a bag full of sand? I mean, it's already broken. Breaking a piece of sand is harder. So that's kind of the principle that the horse's knee and hock use is let's just break it up into tiny pieces that all fit together and then things will be fine. And, for the most part they are. So they're pretty good at their job, these tiny cube-shaped bones that bear lots of weight, like in the carpus, the knee, or the tarsus, the hock. Sesamoid bones are also small and kind of, weird shaped and hard, but they are usually kind of stuffed into a bunch of muscle or tendon or ligament, much like the navicular bone is, much like the proximal sesamoid bones up by the fetlock are. And they add surface area to a joint, they reduce the pressure by increasing the surface area. So your navicular bone is an example of a sesamoid bone, and interestingly enough, they're actually named after sesame seeds because they kind of look like sesame seeds, and I think that is funny and that a farrier probably named it, but who knows? Probably not. But I think it's great that they're named after sesame seeds because that's how I thought of them when I heard that word. So sesamoid bones, wrapped in muscle, tendon, or ligament, and add surface area to a joint. Wonderful. Now, if you're trying to remember the 5 types of bones and you've gotten through those 3, the 3 that farriers normally use, then you're probably like, what are the other 2? Well, remember that a horse has a head as well, and inside that head is a brain, and around that brain is a skull. And the bones of the skull are called flat bones, and they hold on to soft stuff like the brain. So remember that the horse has a head, and you will think of the bones in its head, like the skull bones, and those are flat bones. Also, when you're looking at the horse, not only does it have a head and legs, but something to connect all of them, and that would be the spine. So the bones in the spine are super weird shapes, like they've got a hole in them to fit the spinal cord, and that's weird. But they're also not skull bones because they're not like big and flat, and so they are referred to as irregular bones, the miscellaneous category of bones. But yes, if you're trying to remember the 5 types of bones, think about the long bones, the navicular type bones, those sesamoid bones, and the fact that horses have knees, and then also consider the fact that they have a head and something that connects all of those things together, the spine, and those are the 5 types of bones. So then talking types of bones in the hoof, short pastern bone, ignore the word short, that's why I'm using it as an example. It has a growth plate, it grows away from the growth plate, so it is technically a long bone. The navicular bone, we've talked about at quite a length, is a sesamoid bone, because it reinforces that coffin joint by increasing its surface area. And I Googled around a lot about it to try and figure out what kind of bone the coffin bone is, and nobody will say. And so I also won't say. But it, in humans, is a long bone. It's just really modified from the version that we have. Obviously, it's wedge-shaped and not shaped anything like the other phalanx bones. It's barely covered in cortical bone at all. It almost looks more like cancellous bone for most of it, even though there's some coating in a lot of places, but it's very vascular, so it's very weird. But it's not an irregular bone because it isn't anything like a vertebra bone either. So the internet doesn't say, so I will leave that up to you guys in the comments to discuss one way or another if you think it's a long bone or an irregular bone or a new type of bone that we don't know about. But I would say, if it were me, I'd say it's just like a super messed up long bone, but I don't have any credentials. So just kind of an interesting thing. But they do have growth plates on the proximal end. Find a picture of the coffin bone. It's kind of like up in here-ish. It's closed at birth, which is why it's hard to see, but if you see like a dissection of a cadaver unborn foal, there will be a cartilage plate in there. So they do have growth plates in them, just up on the proximal end of that bone, and they're fused at birth. So kind of an interesting thing. They grow in a different direction than from the growth plate as the horse gets bigger. They just kind of grow outward and swell up in size. So to summarize, there are 3 bones in the hoof. That's your P2, your short pastern, your navicular bone, and your P3, your coffin bone. Horses stand on their middle fingers, which start at the fetlock. Fetlock down is a finger, so fetlock finger, good to go. And they stand on their middle fingers, which is their third finger, which means that the cannon bone is the third metatarsal. And the splint bones are the second and fourth metatarsal, going from the inside out. So wonderful. We learned that bones can have cartilage both on them, like the articular cartilage, and in them, as in the growth plates. And cartilage turning to bone is sometimes normal, sometimes not. And then there are 5 types of bones. Long bones, like what a cartoon dog would be chewing on. And if there are long bones, there must also be short bones. So there's 2 knocked out right away. Think of the navicular. You got your sesamoid bones, your sesame seeds, and then, of course, your horse has a head, so skull bones, flat bones, and your horse has a spine, so the vertebra bones, the irregular bones. And that's all you need to know about the bones in the hoof. Thank you for watching this video and trying to learn things. I'm enjoying teaching you. We will be continuing on with the Hoof Structures Series in future videos. Thinking it'll be that tendons and ligaments of the hoof video, but there will be other topics still to cover on in terms of hoof structures specifically before we start moving up the horse or talking about bigger topics. But of course, if I made any errors or if you have any feedback to give me, if you think it's a long bone or an irregular bone, just put it in the comments, let me know, we'll chat. And yes, I love to hear from you. So thank you and stay tuned for more.